Assalamualaikum warahmatullahi wabarakatuh. This meeting we're going to focus on analysis, nursing diagnosis. Still with me, Mr. Benny? So please stay tuned and listen to my explanation. Definition of nursing diagnosis. A nursing diagnosis is a statement of the high risk or actual problems in the client's health status that the nurse is licensed and competent to treat. There are 5 types of nursing diagnosis. The first is actual nursing diagnosis. The second is risk nursing diagnosis. The third is possible nursing diagnosis. And the fourth is wellness nursing diagnosis. And the fifth is syndrome nursing diagnosis. Well, let's discuss one by one what actual nursing diagnosis is. Actual nursing diagnosis. It is client problem that is present at the time of the nursing assessment. These diagnoses are based on the presence of associated signs and symptoms. Risk nursing diagnosis. It is a clinical judgment that the problem doesn't exist, but the presence of risk factors indicates that the problem is likely to develop unless nurses intervene. Possible nursing diagnosis indicates that the client's database doesn't demonstrate the defining characteristic or related factors of the diagnosis, but your intuition tells you the diagnosis may be present. Wellness nursing diagnosis indicates that a healthy client has a desire to achieve a higher level of functioning in a specific area. Syndrome nursing diagnosis indicates that the diagnosis is associated with a cluster of other diagnoses, often seen in bedridden nursing home care residents. There are 2 syndrome diagnoses on NANDA: disuse syndrome and rape and trauma syndrome. Components of analysis phase. Major components of analysis phase. Number 1, analysis and interpretation of data, including validation of data and clustering of data. Identification of problems or healthcare needs. Formulation of nursing diagnosis statement. Diagnosis versus nursing diagnosis. Medical diagnosis deals with disease or medical condition or pathology, treating or curing. Nursing diagnosis deals with human response to biopsychosocial stressors and or health problems that a nurse is licensed and competent to treat. Advantages of nursing diagnosis. For client, individualization of care, appropriate selection of intervention, establishment of goals. For nurse, facilitates communication, documentation, and continuity of care among healthcare providers. Nursing diagnosis statement diagram. We have priority, patient's problem. This is the cause. There are signs or symptoms and needs or problem etiology that come from the assessment. What you see that supports the problem. RT here means related to. EB or MB is evidenced by or manifested by, followed by signs and symptoms. Patient's need or problem is NANDA approved statement found in the book. For example, pain related to tissue damage, as evidenced by patient complaint of pain at level of 7 out of 10. Constipation related to poor fiber intake, evidenced by no bowel movement for 3 days and abdominal distension. Risk for injury related to generalized weakness. How to prioritize multiple nursing diagnoses. Number one, actual firm diagnosis supported by nurses' findings, validated. Number two, high risk or has risk factors but doesn't have signs and symptoms, more vulnerable to develop problems. Possible tentative additional data needed to confirm or rule out problem. Part 1 of Nursing Diagnosis Statement, Diagnosis Labels. So we have qualifiers or modifiers plus problem or diagnostic focus. For example, the qualifier is impaired and the problem is gas exchange. So it can be impaired gas exchange. Part 2. Nursing Diagnostic Statement, Etiology. Remember the clue is RT or related to. Educated guess as to what factors are contributing to or causing the problem. Place between problem and etiology to indicate relationship between them. Can't be a medical diagnosis, must be modifiable by nursing intervention, must be able to do something about it, and will be in one of 5 categories such as environmental, situational, psychological, pathophysical, and maturational. Part 3 of Nursing Diagnostic Statement, Defining Characteristic, Evidenced by or manifested by. Sign and symptoms assessment data that led to your nursing diagnosis. For example, client stating food intake is poor. Client states they are in pain. Client hasn't had a bowel movement in 3 days. Client has open wound on buttocks.